Drug addiction, also known as substance use disorder, is a chronic medical condition characterized by an individual's compulsive and uncontrolled use of drugs despite harmful consequences. Drug addiction is a complex and multifaceted disorder that affects the brain's reward system, leading to changes in behavior, cognition, and emotional regulation. There are various factors that can contribute to the development of drug addiction, including genetic vulnerabilities, environmental influences, and psychological factors. Common risk factors for drug addiction include a history of trauma or abuse, mental health disorders, lack of social support, and easy access to drugs. Drug addiction can impact individuals of all ages, genders, and backgrounds. It can lead to severe health consequences, including physical health problems, mental health disorders, and an increased risk of overdose and death. In addition, drug addiction can have negative effects on relationships, employment, and overall quality of life. Treatment for drug addiction typically involves a combination of behavioral therapies, medications, and support services. It is important for individuals struggling with drug addiction to seek help from healthcare professionals and support systems to address their substance use disorder effectively. With proper treatment and ongoing support, recovery from drug addiction is possible.
Opioid drugs are a class of drugs that include prescription pain relievers such as oxycodone, hydrocodone, codeine, and morphine, as well as the illegal drug heroin. These drugs work by binding to opioid receptors in the brain and body to reduce feelings of pain. While opioid drugs can be very effective at managing pain, they also have a high potential for misuse and addiction. Continued use of opioids can lead to physical dependence, tolerance, and addiction, making it difficult for individuals to stop using the drugs without experiencing withdrawal symptoms. Opioid overdose is a major public health concern, as opioids can slow down breathing and heart rate to dangerous levels. In recent years, there has been a significant increase in opioid-related overdoses and deaths, leading to a national crisis in many countries. In response to the opioid epidemic, efforts are being made to increase access to addiction treatment, improve prescribing practices, and promote the use of alternative pain management strategies. It is important for individuals to be aware of the risks associated with opioid use and to use these drugs only as prescribed by a healthcare professional.
Cannabinoids are a group of compounds derived from the cannabis plant that have various medicinal and recreational uses. The two main cannabinoids are tetrahydrocannabinol, THC, and cannabidiol, CBD, each with different effects on the body. THC is the main psychoactive component of cannabis, responsible for the high feeling associated with marijuana use. It has been used medically to help with conditions such as chronic pain, nausea, and muscle spasticity. CBD, on the other hand, is non-psychoactive and is often used for its potential therapeutic benefits without causing a high. It has been studied for its potential anti-inflammatory, analgesic, and anti-anxiety effects. There are also synthetic cannabinoids, such as dronabinol and Nabil-1, which are FDA-approved medications used to treat nausea and vomiting associated with chemotherapy, as well as appetite stimulation in patients with HIV/AIDS. Cannabinoid drugs can be administered in various forms, including oral capsules, oils, edibles, and inhalation through smoking or vaporizing. It's important to note that the use of cannabis products should be supervised by a healthcare professional, as they can have potential side effects and interactions with other medications. Overall, cannabinoid drugs are showing promise in the medical field for a wide range of conditions, and research continues to explore their potential therapeutic benefits.
Cocaine is a powerful stimulant drug that is derived from the leaves of the coca plant, which is native to South America. It is a highly addictive substance that is typically snorted, smoked, or injected. Cocaine works by increasing levels of dopamine in the brain, leading to feelings of euphoria, increased energy, and heightened alertness. The short-term effects of cocaine use can include increased heart rate, elevated blood pressure, dilated pupils, and reduced appetite. It can also cause feelings of intense pleasure and confidence, as well as increased talkativeness and Long-term use of cocaine can lead to a range of negative health consequences, including heart problems, respiratory issues, neurological complications, and mental health disorders such as depression and anxiety. Chronic use of cocaine can also lead to addiction, which can be difficult to overcome without professional help. Treatment for cocaine addiction typically involves a combination of behavioral therapies, counseling, and medication. It is important for individuals struggling with cocaine addiction to seek help from qualified healthcare professionals in order to address their substance abuse issues and work towards recovery.
There are several different types of medications that can be used to treat both depression and insomnia. Some common options include drugs like barbiturates, amphetamines, benzodiazepines, and other similar drugs that are normally used as medicines to help patients cope with mental illnesses like depression and insomnia are often abused. Several plants, fruits, and seeds having hallucinogenic properties have been used for hundreds of years in folk medicine, religious ceremonies, and rituals all over the globe. When these are taken for a purpose other than medicinal use or in amounts/frequency that impair one's physical, physiological, or psychological functions, it constitutes drug abuse.